And then I'm going to move us on to Facebook Live here. I'm just going to change the view. So if you guys don't mind muting yourselves, just so that we can make sure that the people who are speaking are the ones that will pop up on the screen. I think we've got that. All right. So all right. We should be live now, streaming on Facebook as well. We are recording this. I just want to say welcome to everyone here. I'm really excited about tonight. But yes, I would like to welcome everyone joining us this evening with an evening with Dr. Dennis Raphael to discuss the social determinants of health. Some of you may know me already, but my name is Erika Lougheed. My preferred pronouns are she and her and Elle. I currently am a municipal councillor in East Ferris, as well as your Ontario NDP candidate for Nipissing in the upcoming provincial election. So before we get going, I just want to have a quick land acknowledgement. And I know that they have become increasingly common over the past few years. It's important to me that they occur, but it's also important that people understand why they're occurring and the purpose of a land acknowledgement. And it may be different depending on who you are. But for me, as a non-Indigenous person, a land acknowledgement is a sign of respect, a respect for the land that we're gathered on today. As treaty land, recognizing the path that we're walking on today is definitely tied to the events of yesterday and the events that will unfold tomorrow as well. It's very important to understand that we're all tied to this, past and present, and the choices and decisions that we make, particularly with respect to the conversation we're having today on politics and healthcare, that the decisions that are made with knowledge and context. So for an Indigenous person, a land acknowledgement may be a sign of respect, but also of custom. Land acknowledgements have been around for quite some time. Definitely a way of seeking permission, especially when entering another person's territory. It's a way of saying hello, if you will. My partner, Sean, likens this to taking his shoes off at the door when he used to visit his grandmother's house. So with that being said, we'll begin today by acknowledging that we're on the Robertson Huron Treaty Territory, and the land that which we gather is the traditional territory of the Nipissing First Nation and Anishinaabe people. So I would like to introduce our guest, Dr. Raphael. Dennis is a professor of health policy and management at York University. His research and work is focused on the health effects of income inequality and poverty, quality of life of communities and individuals, and the impact government decisions on Canada's Canadian health and well-being. He's written multiple books, of which I have, articles and chapters in journals, notably The Social Determinants of Health, which I'll put up a link shortly in the chat that you can access. It's been downloaded over 1 million times, and again, wrote the book on poverty in Canada. So thank you very much for joining us. And just before we get started, I know we have some people joining in on the Zoom and some people via Facebook Live. The chats will be monitored, so my eyes might dart to the side. We'll do our best to gather feedback and questions as time permits. The video and audio and the Zoom participants, the video can stay on, but if the audio can be muted yourselves. And if you can all take a moment, actually, and just take a pause, anyone who's watching, and share this on your social media. Go to the Facebook page, you can go to mine or the NDP Riding Association page and share the event so that the live stream is also then going to be on your own page. So with that being said, hopefully you're all sharing right now. I'll get started. So yes, for those who are new to the subject, Dennis, what can you explain and help us understand about the social determinants of health and what the government's role in social determinants of health are?
Well, the social determinants of health made a revival in the 1980s, 1987. And basically, it's a fancy word to refer to living and working conditions as being important determinants or predictors or influences upon health. Now, this is not new. Plato, Aristotle, Friedrich Engels in 1845, it's always been known that living and working conditions shape health. But for a variety of reasons, the discovery of germ theory the emphasis on lifestyles, the individualism, it kind of got pushed off to the side explicitly in terms of influencing health. Now, since the 1980s, primarily there were studies done in the 1970s, the Whitehall studies, 1980s. Even since I started in this stuff in 1996, there's been a profound accumulation of information. And it's not only that these are important predictors of health, these, and what do I mean by living and working conditions? Income, food security, quality of housing, security of work, transportation. These factors, especially income, swamp the effects of everything we've been indoctrinated in. In terms of medicine, medicine's great, right? But in terms of the additional 40 years of life expectancy we now have since the early 1900s, only about 15% of that can be attributed to all of the advances in medicine. Similarly, the obesity, the physical activity, the fruits and vegetables, even the smoking is swamped by the effects of one's circumstances, especially income. We did a really big study using the Canadian Community Health Survey, which is generalizable to the entire population. Once you're poor, being overweight or physically inactive didn't add any predictability to whether you come down with type 2 diabetes. And the other thing I'll just say as an introduction, so what we're talking about, the social determinants of health, it's been a long day for me. What's the list? The list is education, employment and working conditions, food insecurity, geography, health services, housing, income, social safety net. These are the non-medical and non-behavioral factors that literally swamp the effects. And the final thing I'll add is that living under adverse circumstances as a child is a better predictor of coming down with cardiovascular disease and type 2 diabetes than the lifestyles that people live as adults. So we're talking about profoundly important factors. That's number one. Number two is that they are a result of public policy. I mean, you could focus on the individual and say people with more education earn more money, thank you, and sit down. But the reality is that our society is set up that if you happen not to have a lot of education and don't get into a high-level job, you're basically being written off in many ways. In contrast, I'll give you one example. There's something called low-income, low-wage jobs. And a low-wage job, according to international standards, is you earn less than 2/3 the median income. So imagine the income is 80,000 in a country. If you earn less than 60,000, you're said to be, let me see, less than 2/3. Yes, you're said to be a low-wage worker. 22% of Canadians are low-wage workers. In Finland, it's 6%. So is everybody in Finland a genius? Is everybody in Finland highly motivated? No, it just happens that in Finland, if you happen to work at a local submarine, which is very, a subway is apparently really popular in Scandinavia, you're not a low-wage worker. So public policy sets the parameters of wages, of social assistance, housing affordability, education, being able to attend university. So public policy profoundly affects the distribution of all of these social determinants of health. And the third thing, which will conclude this little part, is that our public policy is awful. It's terrible. And in the poverty book and elsewhere, when you look at how things play out, and it's not just Scandinavia, how they play out in Germany, how they play out in Belgium, how they play out in Switzerland, a person living in any of those countries has a profoundly lower chance of being low-waged, of being poor, of being without labor training. So it's three things. One is these things are really important. 2, they're shaped by public policy, and 3, none of them are getting better. There's no evidence that the housing situation is improving. There's no evidence that the food insecurity situation is improving. And this was all before COVID-19. And the beauty, if there is a beauty of COVID-19, it's made obvious that there's families sharing apartments, that there's people who, when they miss one paycheck, they're in threat of eviction. So that's kind of the picture. These things are important factors that predict health. 2, they're shaped by public policy. 3, Canada's public policy profile is nothing to write home about. And 4 is we don't hear about any of this stuff.
Yeah,
So
absolutely.
that's the other thing.
It does seem like it's, I think anybody listening in on the call, it can recite and remember times when they've been unable to make ends meet, or they're stressed about money, or maybe someone's on the call right now is in that situation at the moment, that it not only impacts you, but it impacts your entire family. It impacts your health, your relationships. It's a very big trickle effect. It isn't good. But despite decades of evidence that you cited, governments of all stripes have not prioritized the social determinants of health in their public policies. I'd say governments of all stripes and governments of all levels as well. Why do you think they haven't done that?
Well, the academic argument, the academic throwaway is Canada's considered, and we'll talk about Canada, Canada's political scientists talk about different forms of the welfare state. I think we can most easily grasp the social democratic one. Norway, Denmark, Finland, Sweden, where there's high taxes on the wealthy. There's 80% of people belong to unions, 90% of people work under a collective agreement. Government is, the state is seen as the primary institution in the society. And it's hard for us to imagine, but they've actually are driven by the ideological inspiration of equality. And these are 2 political scientists that I reference in the Canadian Facts. And it really, that's a main ideological inspiration: universalism, equality, and people have given their allegiance to the state because they believe the state does well by them. There's this movie called Poor No More, Canadian video. It's on YouTube, Poor No More. And they interview Swedes, and they interview this woman in a Scandic factory that makes giant trucks. And she's banging. And she said, in Sweden, you don't have to worry because you can get sick, you can get hurt on the job, and you'll be taken care of. So that's the social democratic thing. Then there's the conservative welfare state. And forget the word conservative. It's not North American the way we use it. Conservative welfare state is Otto von Bismarck, the welfare state in Germany. It's Angela Merkel. This is the conservative welfare state. And it looks very much like the Scandinavian welfare state. Everybody works under a collective agreement. They have long-term industrial planning. If you watch the movie, which is on Amazon Prime, called Where to Invade Next, in Germany, people kind of were incredulous when Michael Moore asked if you work more than one job. And they said, well, we have to work more than one job. We get paid well. So that's the conservative welfare state. And their main ideological inspiration is called solidarity. Because business barons, they recognize that the Volkswagens don't fall apart because their workers are well-trained, loyal, and they have long-term planning. Now we get to the bad guys. The bad guys are the liberal welfare state. And again, the political scientists use the word liberal to refer to the form of welfare state. Now, it turns out the Liberal Party in Canada is a liberal party, but the Conservative Party in Canada is also considered a liberal party. And in the liberal welfare state, it's Anglo-Saxon. It comes from England. It includes England, Canada, the US, New Zealand, Australia, and Ireland. Here, the main institution is the market. So what that basically means is the main ideological inspiration is not solidarity like the conservative governments. It's not equality, it's liberty. And the main idea is to get government out of stuff.
Mhm.
So what that basically means, I joke about it, is if you happen to be a member of the Swedish parliament, you wake up in the middle of the night with an idea that says, we're getting more immigrants. How do we integrate them in? Or there's been a rise in unemployment. How do we respond to that? Well, the main ideological inspiration, Canada, as in the other liberal countries, is you wake up with an idea how to get government out of something, get them out of long-term care, privatize, as Mike Harris did, long-term care. We see the effects of that.
Our legacy.
Get government out of stuff.
Yeah.
So if that is accurate, and there's a lot of evidence it is, it explains why it's so difficult here to get pharmacare, to get childcare, to get health care. If you watch Prairie Giant, you can see how long it took Tommy Douglas to get health care. And if it wasn't for Tommy Douglas, we wouldn't have health care. I mean, I'm not an adherent of the great personality theory of history, but clearly without Tommy Douglas, you just never would have had health care here. So we have a situation where the marketplace dominates. Now, what does that mean? It doesn't mean that your little store down the street has influence. It doesn't mean that the Korean store owner. It means big business has influence. The banks, Canadian Tire, the Business Council of Canada. So if we wanted to do all these good things that we'd like to do, we'd have to raise taxes on the wealthy. And you guys all remember the $50 billion in cuts that Paul Martin did, the $10 billion in cuts, spending cuts that Flaherty did. So for us to begin to take care of these issues, the precarious work, the lack of affordable housing, the pharmacare, we'd have to spend more money. Now, is that possible? Well, of course, because our tax rates are much lower than most other OECD countries. So what you'd have to do is increase taxes on corporations and wealthy people. That's not rocket science. Even the liberals are doing that now. Even Kathleen introduced the wealth tax, or not the higher income thing. So you have to deal with individual issues. You have to advocate for childcare. You have to advocate for addiction programs. You have to advocate for pharmacare. But these are all embedded with an imbalance in power and influence. Now, as I suggested, it's much more equitably balanced in both the Scandinavian countries and the continental countries. So what's a good indicator of the imbalance? Only 30% of us work under collective agreements. And it's very skewed towards the public sector. So I think something like 70% of the public sector works under union, has a unionized collective agreement, and only like 17% of the private sector. Why? It's really hard to organize in Canada. And even though labor law says that Walmart can't fire you for organizing, they do it. So everything is set up, skewed against the common good. So what does it mean? Well, first of all, we can go back to the 1970s in Canada, when the government used to provide all kinds of affordable housing. We could go back to the 1970s when minimum wages put you above the poverty line, but there's been this systematic deterioration of the quality and distribution of the social determinants of health. And it's not as if I got this all wrong and everything's fine. You know, all you have to do is open up the newspaper and look at affordable housing crisis. The percentage of people who can't access and pay for their drugs. This is a Commonwealth study. It's all in the Canadian facts. So the system is working really well for some people, but the stagnating wages of 60% of the population suggest that it's not working for the majority of Canadians. And when you begin to deal with the real problems, whether it's, I believe you said the poverty rate was North Bay was 17%.
Yeah, that was a little bit ago, but it's around hovering around 17%. Yeah.
It's very difficult. I mean, we can look at the GDP, we can look at the stock market. God, every morning, you know, I click on the TS.
Mhm.
I turn to my wife and say, we just made X more dollars. You know, it certainly works really well for
Mhm.
some people. And unfortunately, for whom it's working really well are the people that call the shots, the
Mhm.
power and influence. And sometimes it's blatant. Who was the finance minister? That Moreau, right?
Yes.
Morneau.
More
He's
no.
on Bay Street. John Manley, Liberal cabinet minister. He's now the chair, the CEO of the Canadian Business Council.
Mhm.
So what I'm basically suggesting, and again, it's well documented, is that since the 70s, there's been this systematic move away from a concern with the whole towards the interests of those who are doing well. And it's not as if they're suffering. I mean, Walmart makes billions of dollars a year, yet they pay their workers minimum wages. Tim Hortons, very profitable. The banks, I mean, in class, without preparation, I'll just type in bank profits into Google and bring it right up to my 100 kids. And it'll say Royal Bank made $2 billion. And I'll say, oh, you know, they're doing really, really well. I'm sure they treat their tellers really well. So you then type in bank salary, RBC tellers, and you see it's $14, $14.50. So that's the kind of stuff that is not tolerated in other countries.
Mhm.
It's not tolerated. And sometimes it's not tolerated because 80% of people belong to unions. But in places like Germany and France, it's not tolerated because the business community doesn't tolerate it. Because they basically see it's not good for a society to have this profound inequality with a significant proportion of people literally suffering, which is what happens. I mean, one of the takeaways from the poverty book, I just finished teaching a course today, so I'm really on top of it, is that people really are suffering, the bottom
Mhm.
12, 15% of people. And not surprisingly, they get everything. They get diabetes, they get cancer, they get respiratory disease, they get heart disease, they get arthritis, they get dementia, they get kidney disease, every known disease. So that's kind of the big picture. And it's been happening for 20, 30 years.
Mhm.
And the problem is that it's not being called out by those who should be calling it out. Certainly the
So, oh,
poverty and the environmental groups do. But when's the last time you heard somebody on your local bus or anybody say, hey, the system's not working for me?
no, for sure. It's one thing I know what I've mentioned to you before is that we're really seeing the downstream effects of not investing in social determinants of health in Nipissing quite clearly. I mean, it's always been a dark kind of secret, but now it seems to be much more prominent, much more in the newspapers, and it's coming out quite a bit more. Although the numbers have yet to be updated with the current pandemic, and I recognize that gathering the exact numbers would be a challenge. But our health unit decided that 1 in 7 families in are food insecure in the district. 60% of food insecure households have income from employment, and about 64% of people receiving social assistance in the district are food insecure. And I know these numbers probably aren't surprising to you. Again, our child poverty rate is 17%. We have hundreds on housing wait lists, multiple overdose and overdose fatalities a week, a very large and expanding precarious labor pool, and an incredible rates of people accessing food charity. And despite all this, I know that you have a larger focus in Canada, but despite all this, we have yet to see a substantial response from the province or from the country overall federally. And I often think about the gravity of the fact that a quarter of the people, for example, who are food insecure accessing food charity, only a quarter of them are accessing food charity. And so, like, what had to happen to get them to that door, and what's happening to the rest of the people who are just suffering in silence, if you will. But how did we get here? And
And how we
what
get
would you, yeah, but would you argue that would you argue that many of the Band-Aid approaches are actually cementing the problems and poor outcomes? Because a lot of times we see people kind of throwing money at the downstream effects of this stuff instead of the root cause, because addressing the root cause isn't very flashy.
well,
It,
let's first of all, I always say this to people. It's first of all, the immediate stuff is worth doing to a point. So
Mhm.
I remember I was giving this talk maybe 20 years ago, and a woman said at a public health conference, "You got me so depressed." I said, "What do you mean?" "Well, I run a drop-in center for single moms in Naima." I said,
Mhm.
"Well, what you're suggesting is that it's not doing anything." I said, "No, I didn't say that. What you're doing is absolutely essential. You're saving these people's lives, but you're not, but if that's the only thing we do, we're not doing anything to solve the problem." So let me give you some interesting things to think about. If I say the word breakfast programs to you, with number one giving you a bad feeling in your chest, and number 10 making you feel nice and warm, what number do you give me? I say breakfast programs. 10, right? Breakfast programs. They're great. Well, it turns out there's a whole literature, and that's why food advocates don't call them breakfast programs anymore. They call them feeding programs. And what they've done is they found there's a whole range of adverse side effects where the kids are stigmatized, the parents are stigmatized, even the people running the programs kind of look down. And what it does is, number one, there's a tremendous amount of stigmatization. And secondly, it depoliticizes the issue, which gets me to food banks. Food banks, first of all, they only serve 25% of people that are food insecure. Why? Because the people who use it hate it. They feel stigmatized, they feel looked down upon, they feel like they failed as parents. So there's a whole literature on the stigma experienced by people. Secondly, the average person, if we do this 1 to 10, they feel good. CBC has this, sounds of the winter. What is it? Sounds of the season. That's what it is. So people give money to food banks. They think food banks are solving the problem. Well, food banks are not only not solving the problem, many people are now saying they're making it worse, because the image of them managing the problem and doing so well, again, lets the hook off. So you find provinces are donating money to food banks now to improve capacity. But let me give you the third thing, which is the worst thing. 10 years, 6, 8, last 20 years, whenever I was talking about poverty, I would type in Walmart poverty, Walmart hunger. Until 4 or 5 years ago, what always came up was all these horrific studies and stories about low wages, insecure employment, that people who work at Walmart in the States have to use food stamps, and that basically it was like hell on earth as an employer. And there's a book called Walmart Diary of an Associate, written by an undercover Quebec reporter. So what happens? About 3 years ago, I'm teaching my class, and I type in Walmart poverty. What comes up? 100 things about how Walmart is in a partnership with Food Banks Canada. And it says, Walmart, fight hunger. So Walmart, that arguably is responsible for food insecurity and a whole range of other problems, is now a pal, a partner with Food Banks Canada. And if you go on the web, you'll find this food bank in whatever part of Ontario thanks Walmart for donating a forklift to help move the food around. And we have this paper that is this close to being published in Critical Public Health, where we make the argument. The title of the paper is Take the Money and Run: How Food Banks Became Complicit with Walmart Hunger's anti-hunger producing employment practices. So the corporate sector and the papers and these downstream things, while clearly a hungry mom and a kid walking in and then walking out with some food could be seen as a good, it's actually a bad. because you institutionalize food banks. And even though you're giving Mom and Johnny some food, Mom and Johnny still live in a crappy apartment. They still have a crappy job, and they're probably still living in a dangerous neighborhood. So we have all of these well-meaning things that, in a sense, are endorsing the status quo. And when you see the board of directors, and I'm sure you have a food bank in North Bay, look up who the board of directors are. Now, maybe you'll surprise me and all 10 of them will be committed community activists like you. But I can tell you the Daily Bread Food Bank in Canada, in Toronto, is Royal Bank of Canada, Bank of Montreal, the people whose public employment practices are part of the problem. Now, I'm not saying nationalize the banks or put Royal Bank out of business, but gee, bring in some labor laws that require the provision of benefits for temporary workers. And Kathleen Wynne, of course, on her deathbed, remember the month before the election, when everybody gave her a 1 in 10,000 chance, brought in this Fair Employment Act, where if you were a temporary worker, you were required to become a full-time worker, you were given some sick days. There were some other things that weren't bad, but she was on the deathbed. They were on the way out. And of course, when Ford came in, he got rid of all those things anyway. But so you have this whole complex where there's a power imbalance, bad things are happening. We were talking about Habitat for Humanity, is that it? And they build homes for people. Well, we looked up how many homes were built each year in Canada. There was something like 135 homes. But everybody thinks Habitat for Humanity is building homes all over the place. Well, they're not. So you have well-meaning people trying to do what they can, whether it's food banks, and that's another thing. Bring up North Bay Food Bank, and the pictures you're going to have is everybody smiling. The volunteers smile, the staff smile, the guys giving you the check smile, but they never show pictures of the people there because they're not smiling. So everybody feels really good about food banks when they really should be feeling angry about the fact that we need food banks. So well-meaning people step in, the churches step in, they set up overnight shelters, the food banks step in, the breakfast programs step in, the home visiting programs step in, and they're like gerbils running a treadmill. So you're doing all this running and running, doing this, doing that. The amount of time and energy that goes into breakfast programs. Why not give this family an extra $10 a week so they can buy their own Cheerios for the kid? So it becomes accepted. The people that I would see as contributing to the problem then take it over. So Graham Ritchie's, the social worker, he's been writing about food banks since 1986. He has a book, the title of which is along the line, it's called Food Banks Nation, the corporate takeover of food banks. So these people knew they had an image problem. Walmart knew it had a problem. So for a few million, $150 million, which is like nothing, that's a tax write-off anyway, they're now seen as the good guys. So again, you don't have to junk the whole system. You just have to make it a little more equitable, recognize we have a housing crisis. And one of the most striking things before COVID, remember when they bought the Trans-Canada Pipeline? They just announced $9 billion or $8 billion. They bought the Trans-Canada Pipeline. I said to my class, for 15 years, they said they had no money for childcare. You have no money for pharmacare, but bam, we suddenly got we own the Trans-Canada Pipeline. And then, of course, with the COVID-19, admittedly, I don't think anybody probably could have done a better job than the Liberals did with throwing money around and helping people out. But all of a sudden, we had billions of dollars for everything. So it used to be, they said we didn't have the money for it. More and more, it's they don't want to do it. Because to do it, you'd have to set yourself against the business sector that again, big business sector, not your little stores in North Bay. Uh, Basically, they don't want higher corporate taxes. They don't want affordable housing because that will inconvenience the developers. And again, it sounds very conspiratorial, but if you look at William Carroll's book called, what's William Carroll's book? It's something called Organizing the 1%. And he maps out the changes that have been happening since the 1970s. Now, when I showed up here in 1975, we didn't have food banks. We didn't have that many homeless people. You didn't hear the horror stories about precarious work. So we've been there before. And there's no reason that we're not there now, because the GDP and the wealth of the country is the greatest that it's ever been. So again, you hear sometimes that there's no resources available. We've never had more resources available than we do now. But it's been a systematic shift away from what I would call either the conservative models or the social democratic models. And it's systematic and it's documented. And again, there are things that could be done. You remember in Ontario, we used to have card checkoff reunions.
Mm-hmm.
So here you are, you work in a place with 50 people, you and Scott go around and say, hey, you'd like to join a union, we'll have a salary. People would sign the card checkoff. And once they hit 51%, bam, you reunionized. Well, Harris got rid of it. The Liberals said they'd bring it back, and they brought it back for the construction industry. So they, again, tipped the table, because if you have a, quote, democratic open election, which sounds great in theory, but when you have a democratic open election, business brings all its influence on. And if you get unionized in the Caterpillar plant, they get up and leave. Remember when Caterpillar got up and just left London? And in Quebec, when they unionized the Walmart, they just closed it down. Mm. So it's an imbalance. Again, we're not going to solve this overnight. We're not going to nationalize the banks. We're not going to suddenly bring in a profound housing subsidy program. But at least let's make some attempt to move in that direction, because the downstream stuff doesn't work. The food banks, the housing for habitat, and to show you how insidious it could be, the Public Health Agency of Canada announced a new program where they're going to give grants to local communities to address the social determinants of health. And my first thought is, okay, you're going to lay it on the community so I don't have to worry about it at the federal or provincial level. And then somebody on my listserv said that she had been on a call and they announced that there were going to be something like, there was like 700 people on the call, and there was going to be 35 projects across the country. So they're very good at managing the stuff. They're very good at managing and giving the impression.
Yeah, but the one thing that people here might be sitting with right now is there's an incredible expansion of food rescue, for example, in the community with partnering with the grocery stores. And I know personally, anytime I've mentioned this balance being off, it's very threatening. It's a threatening it's threatening because it threatens that status quo and what maybe our feelings, and we feel good giving, and this seems like a good thing, but it is hard to challenge, that's for sure. But just to give a little bit more local context, first of all, you mentioned Harris twice, and I think everybody in the room here is kind of going like, because that's
1990s. Mike Harris.
That's our legacy, right? He's from North Bay. So all of us are probably like, yeah, that guy. But anyway, right now, our current MVP is a cabinet minister, indeed a finance minister, for the budget that immediately preceded the pandemic, and is responsible for a host of cuts that, obviously my position, that undermined Ontarians' social determinants of health across the province. This ensured that, despite Ontario being one of the wealthiest provinces in Canada, Ontario would spend the least on public services and healthcare, while simultaneously
university education. We're right.
Pardon me?
University education.
Absolutely.
spending, we're like 10th.
Oh, yes. There's some people in the room here probably nodding their head as well. But simultaneously, providing incredible subsidies and big tax cuts to the big corporations that you've noted. But from a provincial standpoint, you can really see, but provincially, I guess, you can see how the public have almost been trained to accept these cuts as a necessary measure to reduce the deficit, without fully understanding the implications and the role of government in our collective health and well-being. I often hear, you can Google anything about spending cuts in that budget that I noted, and it's often cited as being savings. Like, well, we cut out the Indigenous Culture Fund, and it will save X amount of dollars. We cut out this program, or we cut this much of tuition or this much funding for universities and colleges, and this is going to save us, save the budget line. And so there's culture of fear. How would you explain to the audience the impact not only of this narrative, but what it means to us, like for our health and communities and province and country, because people buy it. They buy that narrative that
they're embedded in it. It's the only thing they hear. And I was doing a similar thing with another group a few weeks ago. And I was just telling stories about how I mentioned to you that when we were writing this recent article, we looked up attitudes towards socialism. Under 58% of Canadians said they had a positive view of socialism. Now, again, we don't know what's in their head, but clearly they're not, they're not terrified of the word socialism, which could mean sharing stuff, could mean managing companies better. So you have that. And what I said was that if I happen to wear a particular shirt that is somewhat edgy politically, I won't go into exactly what the shirt was, you'd be amazed how many people say that guy was a good guy, or this was that, and what happens is people don't hear any of the ideas they have being reflected back to them. So if you happen to go to Andrew Jackson's work, who used to be a vice president of Canadian Labour Congress, or Jordan Brennan, who's an economist with the uniform, you'll read about corporate power, you'll read about corporate concentration, you'll read about control of the media. But the average person doesn't go there. The average person doesn't know to go read Sam Gindin at York University. Or for that matter, they don't know about me. Because how many years have I been doing this? 24 years. You're the first NDP person who's ever asked me to do anything.
It won't be the last.
24 years. Now, whether it was, we won't name my local MPP, or for that matter, my former MP who had a PhD in political science and unfortunately died 10 years ago. Jack wrote a foreword to my poverty book. Mm-hmm. They don't say this stuff. And, I always tell this story when the Liberals were in that, if Andrea Horvath, to name someone, came to a mic and said, this is Mrs. Smith. Her husband died last year. Mm-hmm. She has 2 sons. And she works 50 hours a week. But because of the wage structure in Ontario, she has to go to a food bank. Or this is her apartment. Through no fault of her own, Mrs. Smith, and you could make sure she's white so we don't race bait people, right? But whether she's white or she's ethnic, you say, there are thousands of Mrs. Smiths in this country who, in this province, who because of no fault of their own, have precarious work, bad housing, their kids are at risk of getting heart disease and diabetes because she's not able, through the wage structure, to give them a decent life. You don't need 80% of Canadians agreeing with that. You don't need 60% of Canadians. But considering where the NDP is, they got nowhere to go but up. But they don't want to do that. Nobody wants to sound like Tommy Douglas anymore. And if you listen to some of Tommy Douglas's speeches, they're tremendous. Or Stephen Lewis's father, who was anyway, the leader of the NDP, Stephen Lewis's father.
You talking about Avi Lewis's father or Stephen?
Stephen Lewis's father. He was the leader of the NDP when Tommy Douglas didn't win his seat. It'll come back to me. I'll put it on. But again, this is not unknown to people. Everybody knows that 50% of Canadians would be in financial difficulty if their paycheck was 1 week late. So people know there's something not working. Now, sometimes they're deluded into thinking that we don't have the resources. When I ask students, I said, do you think our GDP over the last 20 years has been going up, going down, or staying the same, adjusted for inflation? Nobody ever says we're wealthier now than we've ever been before, but we are. So if you look at GDP goes up, adjusted. So we're wealthier than we've ever been before. We're wealthier than we were in the 60s and 70s. But because, as you've indicated, we've been put into this bubble that it's not affordable, it's not sustainable, and you can't trust government anyway, people have lost sight. But having said that, over the last 3 years, there's been increasing support for childcare. Mm-hmm. Most Canadians support pharmacare. And I think pharmacare is a great example. Not only would it be equitable in terms of the distribution of drugs, it would save money. I mean, billions of dollars, because now you'd have what's a fancy word, monopoly, where you have one buyer. So you say, how come we don't have pharmacare?
Yeah.
Well, we don't have pharmacare because there's some influential people who don't want it. Now, if we bring in pharmacare, they're going to get up and leave? They're not going to get up and leave. They didn't leave in Switzerland when they began to manage drug distribution. So nobody is willing to come out and say that Canada, we've fallen behind many other countries. And when you look at these charts that I have in this thing, whether it's spending on people with disabilities, spending on pensions, spending on job training. I put up a chart, really easy to bring up. You type in OECD active labor policy, and you see that we spend something like 1% on job training. And a student says to me, below like every other country, and a student says, has it always been like that? I said, let's take a look. So you just adjust it from 1970 to 2020, and you see 15, 20 years ago, we spent 3 times more than we do now on job training. For every $1 we spend on job training, the Danes spend $4. So when the factories close in North Bay, we just send people home. Just send them home. There's no assumption we're going to train them. There's no assumption we're going to retrain them. So this has been systematic, but the beauty of the thing is that we can point to other countries. I can show you about France and childcare, or Norway, or home care, and they all do it. Life is better. Their crime is lower. I type in food banks Canada into Google. 1,500 comes up. You type in number of food banks in Norway, 7.
Really?
And then somebody says, oh yeah, but Norway is an oil country. And I say, okay, Norway is an oil country. Name another oil country. And somebody says, Saudi Arabia. I said, yeah, name another country that has oil. And they look at me blankly. I said, you can't name another country that has oil? I said, I'll give you a hint. It begins with the letter C.
Yeah, Canada.
Canada, Newfoundland. And, the work from the Canadian Centre for Policy Alternatives about how Norway demanded decent royalties. And guess what? The companies went along with it. They contrast the Norwegian experience with oil companies versus the Alberta and Newfoundland experience. Now, how does that happen? It happens because the oil industry has friends in high places. That's the only reason. I mean, if we suddenly demanded higher royalties from the oils, I call them the tar sands, are all these companies going to get up and leave? No, of course not. They would stay and they'd pay the royalties. They wouldn't be happy. So when you look at housing or pharmacare or uh, oil, or you just look at that and you say there's something askew. And we know that there are ways of doing it differently. But we don't have anybody, or we do have people, but they're not known. You got the Canadian Centre for Policy Alternatives. You have the Parkland Institute in Alberta. But I'd love to include the NDP. You know, I'd like to say, oh, we have some really progressive forces pointing out the problems. We have the Parkland Institute. We have William Carroll in the Corporate Mapping Project. We have the Canadian Centre for Policy Alternatives. We have the NDP, but we don't. So we don't hear this from Andrea or from Jagmeet. You don't hear it. And I don't know, you guys are on the inside. I do not know why they won't go there. I don't know why they won't go there. Because, you know, I had an hour and a half session with this New Left Radio down in London. And we spoke an hour and a half, and all of us just couldn't understand why and you don't have to do everything. You just do wages, just do precarious work, you know, or just do the fact that only 40% of workers qualify for unemployment insurance in Ontario. You know, just take one issue that is outrageous and say there's no reason for any of this. And then you just draw out the fact that not only is it unfair and unjust, the families are suffering and they're going to get sick and they're going to die. So I don't understand. I've been doing this now. And again, you know, first thing I did when I moved up here was join the NDP in 1973. So I'm in Toronto Danforth. Jack Layton was my member of parliament. Peter Tavin's my MPP. Paula Fletcher is my city councillor. And I've been feeding them this stuff for 24 years. And they don't want to go there.
There's some, there are some positive. I mean,
sure, yeah, of course, it's the only choice we have. But yeah, I mean, occasionally I see something. They did push that bill through, condemning Bill 21 in the Ontario legislature at Horvath.
Yes, I was just going to mention that, and I was going to mention too that, you know, there's some promising platform planks coming out, but I do, you know, I listened to that New Left Radio podcast, and it was good. Like, the criticisms are, you know, I recommend anyone here listening to it. It's worthwhile. It's worthwhile to listen to for sure, because you went all out. You were no holds bar.
No, you show up here. I moved up here when I was 24, and 24, you know, at NDP, we had a socialist party here. Like, wow, this is like I died and got to heaven, from New York, Brooklyn, New York, up to here. And now I'm 70 and it's 2021 and we're not any further along. In fact, if anything, we're worse. We're worse. And you want to, you know what remember what I said on that New Left Radio? That if the Liberals are smart, next election, they're going to talk about health equity. They're going to talk about health inequalities. Why? Because Carolyn Bennett's a smart woman. I once said Carolyn wrote a foreword to my book. And I said, Carolyn, you give liberals a good reputation. So they're not stupid. They got Chrystia Freeland. They have Carolyn Bennett. And what next election? Maybe not the provincial election. So you guys, you on the left is okay. I'm not so sure about you guys, you on the right, but they're going to come out. They're going to talk about health inequities. They're going to talk about social determinants, and people are going to respond to that. You know,
whether or not they follow through with it, that's always my criticism.
But you and I know they don't follow through. Yeah. But the average person doesn't remember what happened 4 months ago.
Yeah. There's a reliance on the cognitive dissonance of the collective, that's for sure.
But there's so many things, there's so many good people out there. And that's what I always try to say to my kids in the poverty class. You remember when Sudbury came out with its Let's Start a Conversation about health and not talk about health care at all? Cliff in Sudbury created that video on her own, no support with the province, and 20 of the 36 health units on their own adapted that video. And the message was that health is about everything we're talking about today. And there were some really conservative areas, Bruce Gray,
Yeah.
chat. So the public health community knows this stuff and is trying very hard. You have all the civil society organizations, right? You got all of the Canada Without Poverty, Layla, Farah. You have the CCPA, you have Unifor, you have the Canadian Labour Congress. You got lots of people that are out there, but it's fragmented. It's fragmented. It's very difficult to reach the average person, because even if they do watch this video, they'll say, if this stuff's so important from Dennis and Erika, how come I don't hear about this from anywhere else? How come I don't hear, and we'll lay off the political party for now, how come I'm not hearing, I'm not hearing about
Yeah.
this? So Andre Picard may mention it once every, 75 columns. But that is in stark contrast to the situation in many other countries, where in other countries, you have the official public health policy of Norway is to promote health equity. The official public health policy in Brussels is to reduce health inequalities against among immigrants of color. Now, the final issue is, why even bother with health? And one of the things I noticed in your little introduction, you said health care.
Did I?
Yeah, you said that Dennis is talking about this and that and the determinants of health care.
It just came out of my mouth. If I said it wrong, I apologize.
So if everybody is so caught up with health, I'm not accusing you of that, I'm just saying the average person is so caught up with health care, maybe we're better off not linking it to health. Maybe we're just better off talking about hunger or talking about bad living conditions. But it works everywhere else in the world, that you say not only is there a housing crisis, but these people are going to get respiratory disease.
Mm-hmm.
These people are going to have infections, which later lead to cardiovascular disease because it builds up plaque. So in 1997, the Labour Party won the election after Margaret Thatcher by putting health equity as the cornerstone of the 1997 British election. So it would resonate with people. It's real. People know that when they get laid off, their blood pressure goes up. Mm-hmm. They know that their kid feels really bad about the fact they don't have new shoes. They know that when you have families crowded into an apartment, you have more infections. Mm-hmm. People know this. And all I'm saying is just add it to your concerns about housing. Add it to your concerns about housing. Add it to your concerns about pharmacare. So you don't just come out and say that there's 10, 12, 14% of people who can't afford their prescriptions. Mm-hmm. You then add the next sentence that these people end up in the emergency department and die, which might get to that last thing we were going to talk about.
Yeah, I do want to talk about it because it's, before we move on to it, part of the reason, definitely the motivation for you being here. And I know that, I know Scott Robertson's on here too. He's our federal candidate, and him and I both are advocates for social determinants of health. And I would honestly say, if you don't mind, Scott, that I think it's probably the biggest motivator for what brought me here. And I think, I don't want to speak for Scott, but I know we've had the conversation in the past. So, definitely part of bringing this forward, my frustration of not hearing that narrative is having you here today. But I do want to say one piece of writing that I'm interested in, and I know you've gone as far to study the term social murder in relation to how continued exploitation for the benefit of some lead to the premature death of others. I'm wondering if you can tell us a little bit more about that term, what you've learned about it, and any response that you've gotten from critics.
Well, it turns out, very honestly, in 2007, Robert Chanonis and Ian Hudson, two economists at the University of It's in Winnipeg. It's either the University of Winnipeg or University of Manitoba wrote a book called Social Murder. And what was the other one? Social Murder, and it's worth just getting the title. Uh, and it's called Social Murder and Other Effects of Conservative Politics. And again, maybe I'm not sure whether you have another computer there, but so anyway, the point was they used the term social murder, and I had never really heard the term. And it turns out in 1845, Friedrich Engels had written a book called The Condition of the Working Class in England, and it is just unbelievable. He just talked about what life was like among the factory workers in Manchester and all across England. And he said that these living conditions are killing people. And he documented that. And then he came out and said, well, these living conditions are there because people are profiting from it, the Industrial Revolution and all that. Then he said that the ruling authorities, and he quoted, and the people that are making the money off of this know that they're killing people. And therefore, since they know about it and yet are doing nothing about it, I accuse them of social murder. Because he said that they were dying, they knew they were dying, and he said it may not be an act of commission as much of an act as omission. So I became aware of that 2007, and I always referenced it, but I never used the term. And then in 2017, there was the Grenfell fire, the tower fire in London, where that tower went up. And it turns out that the authorities knew that the cladding they had put on the outside. Okay, first of all, it's a high-rise, poor people, immigrants of color in a wealthier neighborhood. And the housing authorities, when they rehabbed the place, they knew the cladding they were putting up was not fireproof, but it saved money. It also turns out that the machine, the appliance that started it, was a dryer. And there had been a long history of reports that this particular dryer would catch on fire. But the authorities were not willing to force the owners, the makers of it, which I believe were, well, I won't say what company it was. So what happened was that people died. They knew that they were doing it, that they were putting them at risk. In fact, people had commented that this was really not good. And then the fire started and 70 people died. Well, some people made a documentary and they called it Grenfell Fire, Social Murder. And they brought up Engels and they said it fits all of Engels' thing. And then with all the terrible austerity programs taking place, the following year, Professor Grover of Lancaster University wrote a very theoretical article arguing that these austerity programs in England were all there to force people to work. But as a byproduct of them, conditions had become so bad that they were dying. And in the title of the article, he used the term social murder. So what we did was we tracked the use of the term social murder from 1900 to 2021. And we discovered from 1900 to 1960 in all academic journals, and we're talking about all academic journals, it had been used once in 1945 to refer to bad housing in Glasgow. And he quoted Engels. And then you had a few articles showing up. And then, to give you an example, in the year 2021, in the first 4 months of this year, there's been 23 academic articles that are not only using the term social murder, but relating it to the economic system. So what they're basically doing is they're saying, in 1845, Engels said that public policy was killing people. We knew about it, but we didn't do anything. So now they're talking about housing. They're talking about austerity. They're talking about deregulation. And they're basically saying that Engels seems to have gotten it right. Now, again, clearly we know what Engels wanted, but boy, give me Germany or give me Switzerland. I'll be very happy with what we could be having. So you're seeing this increasing use. And if you go on Twitter and you do the hashtag social murder, you'll see people are talking about people with disabilities in Canada experiencing social murder. In the indigenous area, the term is social killing, social death. That's the term that anthropologists are now using. And about 3 years ago, maybe was it 3 years ago, I was sitting around one day, we had a very sick cat. And I was just waiting to get it euthanized and I had like 2 hours before we took the cat in. And I just sat down and wrote that column in the Toronto Star about Doug Ford and social murder. And it got into the paper. It got into the paper because it was the weekend of Thanksgiving when they were always scrambling to get articles in. And it turns out the retiring social justice reporter, because she was retiring, had it within her to write an email to the op-ed editor saying, this is a really good column, put it in. So this article came out. You just type in social murder, Dennis Raphael, it comes up. And the editor told me there were 10,000 downloads. I got emails from the president of the OSSTF. And it not only did make us, two things happen. One was the Fraser Institute finally responded to something I had written. And this guy, Eisen, wrote a column saying, Raphael's right about public policy. He's right about the fact that sometimes it might kill people, but he's assuming that the people making this policy know it's going to happen. So some wit in the comments section said something, oh, I feel better now. It's not social murder, it's social manslaughter. So I got kicked back. It was a little frightening at times, but then I kept reminding myself I'm in Canada, that nobody's going to burn my house down. But some of these websites in Alberta are really, really aggressive. One guy posted a picture of my house and the address. Like, whoa. So when you look around, when you look at how can people live on social assistance? Look at the social assistance rates. Look at the food bank use, knowing that 80% of food, 75% of food insecure people are not using them. Look at the poverty rates. Look at any kind of indicators. We have 10 to 12% of the population that we're setting up for sickness, illness, and premature death. So obviously talking about health inequalities doesn't do it. Premature death doesn't do it. Premature mortality doesn't do it. So again, not to say that we expect all these politicians to start quoting Engels, but gee, put some passion into it. Click on Bernie Sanders, listen to him, listen to AOC, and then listen to Jagmeet Singh. Like in the States, this stuff is taking off, where people are saying that we're causing misery and illness and death. And yeah, we're a little bit better than the States, but just bring a little bit of passion into this. Just come out and maybe call out the Heart and Stroke Foundation once in a while and say it would be nice if you mentioned any of this stuff on your website. So that's kind of where I'm at. We've done all the research. When I started this in 1996, I couldn't show you a book you could read. Let's get the picture to show up here. I couldn't give you the Canadian facts. So I had to say, listen carefully, take notes and read this British stuff. But now we have all the Canadian stuff. We have Stats Canada doing a great job in documenting inequality, poverty. So again, for those people who we would expect, just turn up the volume a bit. But even more than that, why not just even talk about the stuff? Mm-hmm. I type in Jagmeet Singh and social determinants, 0 hits, 0. He has never used the phrase social determinants. He's never used the phrase health inequalities. Mm-hmm. So I don't know why they won't go there. Is it complicated? Not complicated. You got a kid, got a stressed out mom, a stressed out pregnant mom who releases more cortisol into the placenta. It makes clotting more likely. It sets up the kid with metabolism problems such that when they become an adult, they get type 2 diabetes.
Mhm.
Everybody knows about heart disease. All of us intuitively know that when you get laid off or when you get stressed out at work, your blood pressure goes up. So what's it like for a family that doesn't have food? So it's not rocket science that when you put people under these conditions, the same way you leave your bicycle outside, it's going to rust. When you subject people to this and their kids, they get sick.
Yeah.
And you don't have to talk about illness. You don't have to talk about morbidity. You just come out and issue a public statement about chronic disease in Canada. And you say that one of the things that's been neglected is the fact that most of the predictors of chronic disease are the conditions that we have been talking about for 30 years. Bad housing, bad work, bad jobs, low income. So that's that's my real pet peeve. I'm not going to get angry at Erin O'Toole for not talking about it. I'm not going to get angry at Trudeau for not talking about it because they never said they were going to talk about this stuff.
Mhm.
So that to me is just make some links. And again, uh, heart disease, diabetes, arthritis, dementia, kidney disease, any disease except, I could take any disease except breast cancer and prostate cancer, tightly related. Osteoporosis is related to class. And
Hmm.
again, the whole chapter on poverty and health, that by the time you read it, you're numbed. My students are numbed by the time they read the chapter on poverty and health. But it's not just the poor people, it's the middle now.
Mhm.
Not just the 12%, it's the bottom 40% or more that are at risk for all of this.
I was thinking a little bit more about, well, first of all, just to give myself a shameless plug, my first op-ed was on the social determinants of health that I sent you. And that came with some interesting feedback as well. And that was a pretty light, very light, trying to make some connections. I'll put that in the chat here too, just if anyone wants to read it.
If you type my name and then Hamilton Spectator, there's
That's a good one too.
about 20 op-eds I've written over the last 12, 13 years for them.
I'll put that one in there too, because that one's also really good. But I have a question that I wanted to ask you definitely, because how can we work together to help people see themselves in this struggle and link it together a little bit better? Because even those who consider themselves middle class don't see themselves in this struggle. And I for sure know on a personal level, I get emails and messages on social media probably once a day, that say, I feel like, we're all going downhill right now and I don't know what to do. What can I do to help? Because so many people are feeling very helpless. And they don't really know what to do. So what advice, when you walk your students through this experience and they're starting to grapple with where they fit in this whole system, what advice do you give them?
Well, luckily, because this first came out in 2000, right? And I'm just going to get this so you can see it. There it is. Came out in 2000. And we did a second one. Section 20, what you can do. And it talks about it. And it has, where's what you can do? It has.
Are you in your Poverty of Canada?
No.
What book are you in?
Canadian Facts.
Okay.
This is
Okay, the Canadian Facts. Good.
And in the appendix on page 88, it says resources on the social determinants of health, policy and advocacy organizations, progressive public policy organizations, advocacy, childcare, disability groups, in the housing, and in the section on what you can do, it basically says, where did we come out and say? Canadians can join or support organizations that work to strengthen the social determinants of health. These groups advertise. We have, again, the appendix of all these organizations that you can either follow or you can contribute to. And it has things like the Institute for Work and Health, Food Secure Canada, Dietitians of Canada, Council of Canadians, the Canadian Northern and Remote Health Network, Health Services. So in there, we talk about professional organizations, get your unions to bring issues. And it turns out, if you know where to look, the Canadian Psychological Association has statements on it. Once a year, they have a conference, they put a statement out, and bam. Canadian Association of Social Workers has statements out, Registered Nurses Association. So you have all of these, one of the things we have accomplished, everybody in public health and healthcare, everybody knows this stuff now, which wasn't the case 15 years ago. They all know it. Every hospital has an equity project. Every LIN, I don't know whether they got rid of the LINs, but they all had to produce.
They are getting rid of them, yes.
Health unit in Ontario, even the most conservative is aware of all of this stuff, but they don't know what to do. And what they need is some central core that they can look to. And I tell you, if you type in Carolyn Bennett and social determinants of health, she will come up. She's writing op-eds, she talks about it. And
acknowledge the fact that someone in the chat wrote me, and just a friend of mine who's Indigenous says the Indigenous community is not a fan of Bennett. I just want to make sure that I want to acknowledge the statement.
Well, yeah, I mean, why should they? But the point is that we'll see a year from now when this election gets called. Let me put it this way. Right now, if you were to spend an hour or two doing a computer search on Liberal Party documents versus NDP Party documents, I would bet that it's going to show up more in the Liberal Party documents than the NDP. And again, we know they don't follow through. But again, the point is that they're good, they're smart. And if what I'm saying is accurate, and that is that 60 to 65% of Canadians know there's something wrong, they are going to go after them. They're going to go after them because they're good. I mean, they are really slick. But so what needs to be done? What needs to be done is what I say to students is get on mailing lists, so at least you don't feel alone. So even if you're on the Canadian Center for Policy Alternatives, it's health promoting to get a newsletter once a month and read that I'm not crazy, right? So that's health promoting for people to feel like we may not be accomplishing anything, but at least I understand what's going on. That's health promoting for people to understand what's going on. Then the next step is, what do? Well, if they happen to have a public health unit that introduces an equity perspective, you write them nice letters, you thank them. If there's a columnist that writes something, you reinforce them. Thank you, Andre Picard, for talking about this. What else do? This is why we did this. I mean, you guys are going to tell me, you read through this and you tell me whether it would be useful for everything we're talking about. Because in here, we talk about stress, we talk about all the determinants of health, we provide comparative data. So again, I know you can't really see this, but we have.
Put it in front of your chest. Put it in front of your chest, maybe. No. Yeah, that's kind of the. Yep.
Inequality, and there's Canada in the middle. But one of my favorites is how much support we give to people with disabilities. And this is, we have something like public expenditure on disability. So these are 36 OECD countries. Canada's second from the bottom.
It's awful.
In terms of what we do either through compensation or integration. So I would say the big thing is to have people download this for free, read it, and then respond.
Yeah.
And, that's what I did on that other webinar I did, right? I said,
Mhm, mhm,
you tell me what we could be doing.
mhm.
You tell me. And so that's why we did this. This was just an attempt where by the time, and it's big print and it's a lot of pictures, it was free. It was done to get out a good analysis. And then let's hear back from people. And one of the most remarkable things is I never just talk to people. I mean, you're like normal people, although you may not be that normal if you all work for health units and you've seen this stuff already. But that's what we did that thing for, to push it out and to hear back.
Mhm.
Because I do what I do. I write journal articles, I do books. This is a real labor of love putting this out, because the whole purpose was to educate. And you said we downloaded 1 million copies of this.
Mhm.
I mean, I could show you it being downloaded 110 times a day. We have this thing we follow. But quite honestly, when people say, what can we be doing? I don't know. I don't know. Uh, I really don't know. I mean, I don't know what to do. But at least we got someone who goes to council meetings now, right? You mentioned the NDP council meeting.
Mhm, mhm.
The other fellow, Scott, well, there's Scott over there below you now. He's running for the fence. And I don't know, you would, I think that it would be a winner. I mean, I think it'd be a
Yeah.
winner.
Yeah.
But just because I think something and it affects me, and when I teach my early child development chapter and I get really riled up,
Mhm.
the fact that we're dooming these kids to chronic disease and that nobody wants to talk about it, I get rattled up. I tell you, my kids get rattled up at York. The first day of class of 12, by the end of the class, they say, why isn't anybody doing anything about this? So I think that, I don't know about, all I know about the NDP is its history, and they call me up and ask for money. That's it. I don't know how policy is made. I don't know whether they do focus groups. I don't know whether, I have no idea how the NDP works. And I've been a member since 1973. They never call me. They never call my wife, who writes books about health policy. So I don't know how they make policy. I don't know what they decide is a winner. I'm in a riding where it's pretty hardcore, Toronto Danforth.
Mhm.
So I don't know whether they do focus groups and they try this stuff out and they find that people hate it. But I think that's unlikely, because anytime I've ever spoken to normal people and I tell them, these families living here are going to get heart disease, nobody ever disagrees with me. So I really don't know why. I can tell you why it's not in the newspapers, because they're all owned by big corporations. I can tell you that if you go to the YMCA, YWCA, United Way, any NGO, or we call them civil society organizations, it's permeated all through it. Everybody knows this. In healthcare, in social work, in medicine, everybody knows all this stuff,
Mhm.
but it's unable to move up into the public conversation.
It's because it's not ingrained in, like, I feel like that whole idea of it's, not going to happen to me, or I'm just noting someone, a friend of mine named Jeff, who works like, ground zero in North Bay, but just that whole, it's not going to happen to me, or how close the middle class is actually, like the reality of that you might actually slip into it. So I'm just, if we don't acknowledge it, it's not going to happen to me.
I think,
um,
look at the Angus Reid. Angus Reid did a really good report on poverty, and they asked good questions. And what you found was that a majority of Canadians kind of get it. Now,
yeah.
it depends how long, what you spend with them and how much time you spend. yes, people have an unbelievable ability for denial. That's the only
Yeah.
way we survive. Because I can think about all this stuff because it doesn't affect me directly, right? I
Yeah.
mean,
Yeah.
I'm not going to lose my job. The house is okay. But if I was on the edge, that's probably
Mhm.
the last thing I want to think about.
Or they're too busy with their heads down trying to make ends meet to think about it at all, right? Like multiple jobs, as you said, and trying to make ends meet. I just, I know we're still going on time here, but I think that my friend Scott's probably like exploding in his seat. So Scott, you can feel free to, he said he wants to say something. So
Okay, sure.
I'm
Well,
going to,
I don't know if you want me to say something or not. I mean, we're talking a lot about the federal NDP. I think my video, I'm not allowed to turn on my video right now. I
oh,
don't know if
sorry, I'll find it. I'm on it.
it's all good. I'm getting tired of seeing my face anyways, but
I think I put it on there. You probably are good now.
um, yeah, I am definitely chomping at the bit to get involved in the conversation. I'm trying my best to give space. It's not about me. But to me, like, these are all winners. These are all winners. I live in a regular neighborhood dealing with all of these issues. These issues are extremely pronounced in my right side of my front door. You know, you were talking about, oh, you don't have to go far, open the newspaper and read about these problems. I don't have to open the newspaper, right? I have to open my front door. So these are all winners. You know, you mentioned the person on the bus, whether he thinks there's a problem with the system. The person on the bus knows there's a problem with the system. The person in the car knows there's a problem. I mean, virtually all the neighborhoods in my city, they all agree there's a problem. We all see it. Yeah. So, I mean, I don't know I know you probably, I'm new to the partisan angle. I was only nominated as the federal candidate a few weeks ago, and I'm a municipal city councilor. So normally I'm not involved in the partisan thing. But to me, the New Democrats federally and provincially are the ones maybe not using the expression social determinants of health. I know I've been using that expression for many, many years. I remember my first municipal campaign in 2014 going to an event at the AIDS committee, and you know, they were like, oh, you were talking about the social determinants of health. And I said, yeah, these are the core issues in our neighborhood. And regular people do get it. You know, I know you're talking about not 80%, probably, maybe not, but a really solid majority in my experience, they understand this. And, you know, we also talked about how to pay for it, and people always talk about paying for it. Taxing the rich, you know, is an extremely popular concept in Canada. You know, I don't think we need the culture shift. I don't think we need the political shift, the ideological shift, or the intellectual shift, or the emotional shift. People understand this, and they're ready for strong action. And the fact that the New Democrats haven't had electoral success federally, or as much as we would have liked, I think speaks more towards how slick you're saying the federal liberals are. You know,
Let me suggest one thing, because I was talking to my wife about this. Let's say we say we need more housing. Okay, we need more this, we need more that. Well, when you limit yourself to at that level, you always leave yourself open to the liberals co-opting you.
we need housing as a right. We need basic housing as a right.
But why not put it in a package that says, you know, all these different things we've been talking about really have to do with the fact. Remember, Ed Broadbent talked about ordinary Canadians, and of course, David Lewis,
yes.
corporate welfare bumps. So what would happen if we suddenly started saying that this is a whole package that indicates that over time, all of these issues have been stilted towards the wealthy and powerful. Now, of course, the Globe and Mail is going to scream bloody murder and talk about class warfare, and the Star will go nuts. But all I'm suggesting is that could these things be put together into a package that somehow suggests, using the very simple bumper, there used to be a bumper sticker we had in the 60s. If you think the system is working, ask someone who's unemployed. So all I'm saying is that maybe the way to stake out territory is to remind ourselves that we come from a tradition that sees its best manifestation in the Scandinavian countries, and that we are fundamentally what's the word? Distrustful, skeptical. We are fundamentally skeptical of the voices that we're hearing. So whether it's skepticism or distrustful, all I'm saying is I've seen it a lot of times that an issue arises, it's packaged as we're going to introduce better housing, and then the liberals just come in and pick it off.
We call that liberal Halloween.
Because we're not fundamentally questioning the assumptions that lie behind the Liberal Party, which is business favorable, you know, all that stuff. But it's great, you know, it's again, you know, we have something, we have a weapon, right? We have this. And I don't know. I mean, I remember 1997. So it was 24 years ago, Marilyn Shirley said to me, got to get you in to talk to caucus about this. She never did. 1997, we did a study on community quality of life in Riverdale, and I interviewed Jack for an hour. I interviewed Marilyn Shirley. I interviewed Peter. And boy, Jack was bright. Jack, I mean, all of them were wonderful. And that's how we made the connection, but they never were willing to take it. Now, in my email, there's a little signature. In my signature, it says, listen to what Jack Layton thinks about my books. Because right before he died, I went to a rally and I was able to ask him a question about what could we do to make the links. And he said, well, Professor, the first thing they just do is read your books. So that was really nice. So yes, I mean, but the point is, how do you break away, right? That's the issue. Housing.
One quick comment on that, if I can. And I'm talking as someone who turned 41 yesterday and been kind of immersed in Canadian politics throughout that time. Usually, the federal New Democrats are guarding against the accusation that they're too bold and that they're too aggressive attacking the problems. Yeah. And so they have to respond to that stance and kind of try to chip away at the federal liberals. And for the first time in my life, and it could just be the little bubble that I'm in of people that see the world the way that I do, but it feels like the regular person, someone like my parents and someone like just average people, you know, median incomes, medium age, median everything, they are demanding aggressive solutions. They're demanding bold changes. And I have not heard that before. I've heard, oh, usually it's the can we afford it, or that might be a little too strong. Maybe we should vote strategically. You know, now it seems people are feeling a sense of urgencies because it's right in front of their faces now. People are literally dying in the streets, whether it's indigenous communities or my city, or, you know, it's people feel the life and death urgency of truth and reconciliation, housing, climate, all these issues. So this is the moment for.
That's great. I mean, again, you know, me, I never talk to people. I mean, I talk to my students and they live it, right? You know, you get the stuff, you know, many of them came now and come, but that would be really good. And now you have to say, we have this shift. How do we shift our messaging? How do we somehow hook these people in and say things that the liberals cannot say? And maybe it's along the lines of the wealth tax. Maybe it's along the lines of
offshore tax havens.
Yeah, offshore tax havens. Right, the liberals all show up in the Panama Papers, right? But yeah, I mean, what's the message? And what I do is, who puts out those kinds of messages? Well, it probably wouldn't be a bad idea to look at the party platforms of the Norwegian Labour Party, or to look at the public health goals of the Swedish National, whatever. And somehow, to me, that's the thing. Because when I hear our politicians saying we have a housing crisis and we're going to bring in more housing, I say, okay, but the liberals are going to say that and they're going to get the herd. So when you have to come in and say that the whole approach to housing is wrong-minded, and in the Netherlands, what is it? 80% of housing in the Netherlands is subsidized. So somehow conveying to people that it's a paradigm switch, that would do. And again, it's a big political party. I mean, I'll go up to Erika now. You're the opposition. You have funds for focus groups. You have funds for doing regular run-of-the-mill people research. And I would love to hear that for the last 40 years that I've been a member, that the NDP has systematically been doing research and focus groups.
They have been. You'll be happy to know.
They have been? Okay.
Yeah, they've been doing focus groups. We heard about it at Provincial Council this weekend, and just generally feel of where things are going, and echoing Scott for sure, and what their feelings are on just general. But a lot of it was the general feeling on the different parties, the different party leadership, who they thought could take us through, and stuff like that. But I admit I don't have like the full details of all the details in the focus group, but I know they do them. Yeah.
Anyway, so that would be my thing, that I've been so many, literally I was kind of alert since 75. So that's a long time. I mean, this is 2021, right?
Mm.
Like 46 years I've been following NDP politics. And I mean, look at what Bernie says. It's a type in, he just comes out and says that AOC says this also, that in a country that has 20% of kids living in poverty, the presence of billionaires is an abomination.
Mm-hmm.
Well, is anybody going to say that in Canada? I can't see Jagmeet Singh saying that. But all I'm saying is that the US in many ways has leapfrogged us to the point where you do have Bernie Sanders, you do have AOC, you do have the squad. And what they're finding is that the youth especially, they don't remember all the red baiting and all that stuff. So when you look at the attitudes of youth towards left politics, we won't use the S word, they recognize that there needs to be a shift. Now, is the word shift would not be a bad word to use. I don't know, but again, I'm not going to second guess all your political strategists. But I'm saying between Tova and I, who have lived through NDP politics, every election rolls around and we're just voting for them because we remember the Regina Manifesto. I mean, the average person, they listen to what they hear. We listen to what they put out. And it wouldn't be enough to get me if I didn't know everything that we're talking about, right? I know about the 1992 Red Book and how they didn't follow through on anything. The average person doesn't know that. The average
when you're in
the
it,
liberals run on the left and govern on the right, as Gilles Duceppe used to say. So that's the thing. What's the hook? What's the message? The message is that it's exactly what Scott just said. Things are not working. Things are not working. And we promised to begin, a kid came home one day when he was like 8, and he said, "You know what I learned in school today?" I said, "What?" He said, "If you're in a hole, the first thing you got to do is stop digging." I wouldn't put that on a slide. So that's the thing, that we have to come out and say that we have a whole series of symptoms: the precarious work, the low wages, the consistent reduction of taxes on the wealthy. And we promise that we're going to start to turn this around. Mm-hmm. It'll be good for all of us. And if you have any doubt about that, go take a trip to Belgium, go take a trip to Germany, go take a trip to Norway. And you can see that things can be done differently. And we used to do it in Canada. Hmm. But I'm terribly frustrated, in the sense that I don't hear it reflected back to me by people who I believe should be doing it. But it would be great. I'm going to follow two of you now. And now, I was telling somebody the other day that I'm not a member now, but that's only because I didn't want to send them $5. But you can't get anywhere without politics. I mean, it's not going to happen on the ground level. It's not going to happen through NGOs. It has to be done through political power. And the NDP is the only show in town.
Yeah. And, yeah, I hear you. And anyway, I think we might put a pause here and just want to say thank you for your time. I've learned a lot today, and I know that I've been following you for quite some time and reading your work for quite some time. So a lot of this is not new information to me, but I do think we can work together to change this trajectory that we're on. And I encourage anyone in attendance that if this conversation and topic spoke to you in any way, please share this event, download and read the social determinants of health at the canadianfacts.org, like and follow Dr. Raphael on Twitter and the Riding Association pages, social media pages, my page, Scott's social media. Follow and share that information, and let that be, I always say, let the beginning of our journey together, because we do need to join together to fight not only for this province and for Canada, but for Nipissing too. And when you can, back us up when we talk about this stuff, so that it doesn't sound like we're the only voices. And although there's lots of coalition of support, but every little bit does count. I'll definitely put up the links and relative information really shortly. I'll post it back onto the social media pages after concluding the event. But again, I'm very passionate about taking a strong position on this, because stress and poverty can be linked to, nearly every disease every voter in Nipissing can get, every voter in Ontario and Canada can get, regardless of that political stripe. And, that evidence is pretty compelling.
The other thing, I've been to a lot of places where there were a lot of gray-haired city councilors.
I know why.
Like Bill Davis, progressive conservatives, and they got it. They understood that even Bill Davis and the PCs, I remember back when the PCs were well to the left of the Liberals in Ontario. So PCs are the closest thing, the old progressive conservatives.
Yeah, it's the old guard.
Closest thing to the continental European, red Tories. So I found when I went out to some rural, semi-rural communities, that these Bill Davis people, again, I find out a lot of them, right? But the Bill Davis guys got it. And again, we have a city mayor, John Tory, who used to be the chief strategist for, so, and again, the red Tories are kind of a dying breed. There's still a bit of them out in the Maritimes. So even your gray-haired city councilors are beginning to get what Scott just said, that this is out of whack, that it's getting so bad. I mean, look at the housing prices in Toronto or the food bank use. But it's an interesting thing, because, if we start to go after food banks and breakfast programs, then we're seen as being cruel and heartless. But there's a lot of good literature out there that can be made available. It's not up to you to convince people that food banks are working against the common good. There's op-ed pieces by Elaine Power that was in the Globe and Mail that said food banks should be shut down. So there's a lot of literature out there. There's a lot of resources. So it's not up to you alone, because there's a lot of really good stuff out there and a lot of comparative stuff. But yeah, it's a real tough problem. It's taken us a long time to get here. And as you were absolutely right, people use denial. People can't imagine anything different. People blame themselves. That's a really common thing. How do you end up with a food bank? I made bad decisions. I dropped out of school. Well, basically, if you dropped out of school in Norway, you wouldn't be coming to a food bank. So there's that. And again, Jeff said something interesting in the chat line about that 2/3 of the kids on street have had trauma. Absolutely. But we need to have a society where even if you've been traumatized badly, hey, we got a place for you to live. And that's one of the things also, that if people have had bad things happen to them, we don't recognize that we have to respond to that. So even if a kid has been badly traumatized and can't really keep his act together, that doesn't mean we let them end up on the street. So it's this whole thing about just taking care of people. And it's not Canadians' fault. Actually, Canadians are quite good when you look at the surveys. When you ask them the right question, is what Scott said. They recognize a role for government, but they get diluted. Oh, we're going to raise taxes on me? Sorry, no, we're going to raise taxes on the Westons. We're going to raise taxes on all the people who own tons of shares in these big corporations. Your taxes are not going to go up. And that's another thing that they use all the time. I don't want to pay more taxes. Well, you're not going to pay more taxes. It's going to be people making X million dollars a year, tens of millions a year. So yeah, it's and another thing I always say to all of you, this is just the beginning. Don't think that, this is going to end and that's it until Erika puts something up again in 4 years from now. This stuff's ongoing. We're all available. Yeah, we know where everything is. If somebody writes to me and said, I'm giving a presentation at City Council about why we have to provide people with decent housing, I can just get off to you articles that show that it's, this, it just came out the other day on Twitter, that it's like tons cheaper to give people an apartment than it is to put them in a shelter. Mm-hmm. Scott's muted.
Well, I mean, just the cost of operating our low barrier shelter here is astronomical, and it's a much needed service for sure. But the cost of housing people with appropriate services is way cheaper, And I was actually going to ask you that. I know we're running out of time, but that's the data that I think would be really helpful in the public conversation. We're talking about this addiction to hearing the word savings, and when people want to hear about government savings, I think that there's a winner in there somewhere to say these upstream approaches are incredibly cheaper than the downstream.
What they say, every dollar on childcare gets $7 better, right? You create a universal childcare program, you create work for women, the money goes back into taxes, it goes into the community, it's good for the kids, good for the women, good for the community, good for crime reduction. But nothing sticks. Nothing sticks. The human rights thing, we thought, that's the other thing, right? Universal Declaration of Human Rights. Admittedly, the Canadian judiciary is really bad on charter of rights. Remember, they bring the challenge that no housing is a violation of the Charter of Rights, and the Canadian judiciary always defers to legislatures. So the Charter of Rights and Freedoms has not been very good, even without the notwithstanding craziness. And to give you something really depressing, if we can't get people to oppose Bill 21 in Quebec, how are we going to get them to do anything? Right? Bill 21, this idea that if I was a religious Jew and I wore a yarmulke, I couldn't become a teacher. That's just creepy. And if they tried that in Germany, can you imagine the uproar you'd hear? But now we got Sikhs, you know Bill 21. Jagmeet Singh cannot be a government lawyer in Quebec. They're not going to get any votes in Quebec anyway, so they might as well take a moral position. But if we can't get people riled over Bill 21 in Quebec, well, maybe we can. There's 2 big international conferences coming up in Montreal, and I've written to the president of the International Union for Health Promotion and Education, saying, I really don't think you want to hold a conference there. She actually responded to me, and I had met her. And another person who's fairly well known in health promotion said, I sit on one of the governing councils. I'm going to raise the issue. A health promotion conference in Montreal with people coming from around the world wearing hijabs and Sikhs, turbans. So, look at the silence on Bill 21, which is really bad. Really, I'm riled up about that now too. So it's a tough one, but I think Canadians knows. I'll end on a really happy note. I have a big poster of Anne Frank in my hallway that I got from Amsterdam. And one of the last things she wrote in her diary was, in spite of all of this, I still think that most people are good at heart. And I think that there are enough Canadians that not only if it's even if it's not affecting them, they see it. Whether they're teachers, social workers, psychologists, public health people, or municipal politicians. They know that we got to be doing stuff differently. It's frightening. I got the 20-year-old, right? That's why I'm still working. You know, I'm just taking the money and running because there's only one of them, one kid. But gee, if he has a psychiatric breakdown, if he gets injured, he'll end up on the street. Nobody's going to stop any of us from ending up on the street. Bad things happen to us. That's frightening. That, you know, if you lose your job and you get depressed and you don't have long-term disability insurance, you're going to end up on the street. And nobody's going to stop that. There's no government policy that says that we will not allow people to be homeless. The shelters are half-assed. They're terrible. You know about shelters. But yeah, it's fascinating. And I really appreciate this because I can tell you, like as I said, this is the first time I've ever spoken outside of to my writing association in a systematic way, exploring these issues, making resources available, hearing back, and it would be fascinating. And again, my wife said to me, "What percentage of votes do they get in North Bay?" And I said, "I didn't look it up, but something's wrong. Something's wrong. That the way we're doing things is not the way we can continue doing things. We have some ideas." And some of it may take a while.
Mhm.
You know, people think unions are evil and horrible. It's going to take a while for them to realize that, you know, when 70% of people belong to a union, the country looks really differently. And that's where the stuff that I sent Erika, we have 2 articles that are about unionization and health that bring together a ton of stuff. And as soon as we get the galleys and they show up, hopefully within a month, I'll push them out to you.
Mhm. Please do.
I also want to recognize Erika quickly for having the initiative to set up a night like tonight in a conversation like this. You're saying she's the first one to reach out for you for this conversation. That's shocking to me, and it just speaks to how passionate she is and how well versed she is, how well read she is, and how good of a candidate she's going to be in this provincial election. So thanks, Erika.
Thank you, Scott.
Yeah. I got phone calls. Carolyn Bennett used to have me in once a year. I once got a call from who's that guy, Dalton McGinty? Gerald Butts called me once when they won the election and said, "What are some things we can do?" Dennis Mills used to call me, the Liberal MP for Toronto Danforth. Never got a call. Never. Just never got a call. That's not true. That's not true. We got one call from the guy who was the MP, Matt Kelway. Remember Matt Kelway? He was a member of parliament for the Beaches. He got Tobin IN. This was right after Jack died. And he said, "Dennis and Toba, I get all of this. I got a degree in industrial relations. We're going to have the next election going to be the second stage of Medicare. We're sending Libby Davies out across the country to do social determinants of health." And I said, "Matt, I've heard this before." And they put a report up and they had social determinants of health. And as soon as the election was called, they took it down. They took it down and I couldn't find it anymore because I used to reference it. And Libby Davies found it in her files. She sent it to me. I posted it out and it's now on Libby Davies' website. And it was called "Healthcare Now is the Time." And I had a whole page about the social determinants. But again, it was pulled down and never restored. So that was the one serious call I got from Matt Kelway. And he's now head of policy at the Registered Nurses Association of Ontario. So yeah, we'll interview him one day, find out what happened. But that's good. I feel generally better than I felt when I began this.
Good.
It's like I said, it's nice to know there's somebody out there who doesn't think I'm nuts.
Oh, not at all. Yeah, no, not at all. And you're right though. Speaking of like getting people together, like-minded people, like, especially now, I feel like it's quite easy to feel isolated, just by virtue of the pandemic, but also that again, like, do other people think the same way I do? Am I the only one? But that goes back to, earlier what I had said is, getting behind kind of this messaging and sharing it where you can to the people in the audience. And again, I promise I'll put up all the links to everything that I can. And you're going to hear more from me for sure. I know that you'll hear a lot from Scott too. And, you know, the narrative where we can. And it's also, I'm finding it hard, Dennis, to get a bit into the media. It's, you know, I've been working at different angles, but, you know, the two op-eds I put out were two of many more. So there's, that didn't get published, but I'll keep trying. Scott, you keep trying, and we'll keep doing as many angles as we can, and hopefully soon we can all be in person and you know, rally together. But yes, I think I'm very happy. I feel very grateful that you came, and just want to say thank you from the bottom of my heart that you're here virtually, and thank you to everyone in attendance. And please give me your feedback and reach out if you need anything, and we'll be in touch again soon. And I think that's it. So thank you very much. I'm very grateful.
And once this thing is available,
Yes.
recording, I didn't say anything that I'm ashamed of. Once this is available, you push out the link. Now, how many people are going to sit down and watch a 2-hour video is another question. But
You might.
yeah. And again, I'll be getting those articles out to you. We have like 4 of them that are close to being published.
We're also going to clip out some pieces of this video too. We'll go through and clip out little bits, but I can't wait for those articles. When you guys see the one that he's been speaking about.
Which one, the Walmart one?
The Walmart one, I'm beside myself. I'm like, is it out yet? Is it out yet? Send, not yet. It is so good.
Second revision in, and it is quote unquote under review.
Oh, I can't wait. So yeah, I'm eagerly anticipating that one too. But thank you very much for your time, everyone. And just want to say thank you. And that's it for us. Have a good evening.
Thanks.
Thanks for coming, Bob.